enhancement, which is why she looks this way, because she gets her touch-ups. So we're going to do a little bit of lifting and sculpting today. This is what I call, what you guys will be hearing about, my Celeste procedure, which is layering all the different three-dimensional layers. We're going to lift the brow, because she likes a high brow. Already looks nice, but still. We're going to lift the cheeks and the face using a combination of threading, filler, toxin, and we're going to be doing it strategically, anatomically, you guys. This is not about puffiness. This is not about, you know, asymmetries and overfill. It's about using the anatomy to your advantage. And in this case, we have someone who already looks very pretty, but how do we maintain that, or how do we slow that down, right? How do we do that? We do it by focusing on areas that give us the most structure and support. And so, you know, I think this is becoming a little bit more common now, but honestly, it was not that way for a long time. So many people overfilling and, you know, overdoing it, not noticing, not looking at people's structures, and not looking at their contours, which is what we want. So I do want to give her a little bit back here because it's going to help lift. I know it's going to make the jawline a little more defined, but that's going to help lift the entire face for her and pull it back. All right, let's switch. Go ahead and massage the jaw. But also the threads, you guys. It's all about the anatomical filling. So I'm going to be presenting, you know, the Celeste procedure, which could be sometimes hidden scar brow lifts, hidden scar neck lifts. We do that all the time. But if you're not looking for surgery, we're going to focus on doing things like threads that are lifting and building collagen. We work with hybrid fillers, so we're doing a combination of Sculptra and Radiesse, or Radiesse and Bellafill, whatever we need to be more regenerative. We want more lifting and sculpting, less bulking. That's what we want. More of that definition. So going, like, you know, right there on the bone and giving that support. And that support does more than you think in terms of her face, because this helps lift. As we age, different areas start to fall that are responsible for a lot of what is holding our face up. And that's why sometimes toxin is good depending on where it's placed. We're going to do that today too. But yes, so Celeste to me is what I think people should look like and are going to look like as time goes on in our community, because more people are realizing people are looking weird, right? Overdone, puffy. You know it, you know right away. And that's the thing. We don't want to know. You don't want to know. You don't want to do it to tell, right? We don't want to tell. So we're using Radiesse because this is biostimulatory. And we'll be able to show you immediate. Obviously, there's always a little bit of swelling. Let me see you looking up a little bit. All right, perfect. So now we're going to focus on, let's bring her chin a little bit more straight so that it gives her a more heart-shaped look, because that's what gives women a slimmer look too. We're on a mission. Her and I are going to lose weight. She's going to lose a little weight. We're going to make her look like totally optimized this year. I know it. Less pain, more optimized. That's what we're going to do with our peptides. I'm excited about it. Today's her day. It's going to be tighter, and she'll look great. So that already looks good. All the girls in my office love the chin, let me tell you. The chin always looks better, so you guys see it's a little more forward. What were you going to say?
Well, what are some of the peptides that help with weight loss?
Well, that's good. So the weight loss stack, so we have a Recodex weight loss stack. A couple things. In the IVs, one of the things you don't see a lot of people talking about actually is carnitine, which we actually are going to be putting in a lot of our IVs more recently, especially after surgery, because it really helps you recover, but it stimulates your metabolism. You can actually take oral carnitine at home, and it helps you lose weight, especially with the peptides. But we are going to put her on GLP. We're going to put our retatrutide, you guys. Why are we doing that? Turn it a little bit this way. There you go. Because it will help her muscle more. And that's the thing. I don't want her to lose a lot of her muscle tone. I want her to keep it. And so if you lose a lot of weight on a GLP, often you can lose a lot of muscle tone. So it's really important that we keep that. So what else are we going to do? We need to do stuff that increases the growth hormone, the growth hormone secretagogues. So what are those? Well, a lot of people use Samorin. This is what they've heard of. This is what I call Samorin. I call Samorin the grandma growth hormone peptide because it does very little. And my girls need like good. We need to see results. We need them feeling young, youthful, jumping around. I want to sit at home, just, you know, withering away. We need them active, out, having fun, enjoying their lives, thinking they're sexy, looking good, you know what I mean? So we'll use something called CJC, which with ipamorelin gives you a lot more of that vibrancy. And again, we can do other things too with that, but that's for muscle tone, and it's gonna give you energy, helps you lose a little more weight as well. All right, let's switch. And she's gonna do that. There's other ones for guys or my women that like to you know, work out a little bit more, be a little more muscle tone, or even bodybuilders, called tesamorelin, or even IGF-1. IGF-1 would be great after a surgery, help you heal. We actually are injecting IGF-1 into muscles with the fat when we inject the fat. We also are using it for post-surgical. We put it in IVs with exosomes. She doesn't even flinch. She's so excited. Look at that contour, you guys. Look. So we have a little more of this, more straight, a little bit higher, a little bit more back. It's gonna look so tight. And so there's one left on the growth hormones. Others help improve growth hormone, but MK677 or ibutamorin also is one of those that does a lot for growth hormone, but it's more if you are not wanting to eat or you're very slim. Very slim guys, slim girls want to gain a little weight, because that one will help you gain your muscle for sure, because it makes you hungrier. Obviously, everyone wants the GLPs because it makes it less hungry. So, okay, let's come back. We're almost there. She needs a good height, don't you think? We need good height on her because she has big features. So this will help give her, so pressure, give her a little bit more height, a little more contour. That's why I like it. That's why I like the Radiesse for her, because it's gonna give her shaping. So look, if I turn her head here, look already, you guys. Look at this, the line here is perfect, you see that? And then now, look at that contour as I turn it to the side, look at the lifting. See?
Oh, yeah.
See it? So I always do a little bit extra initially, because, and then one of the things we can do too is go, perfect, so do a little bit more, see, yeah, a little bit more for height. And I also want to go a little bit more towards the brow, height of the brow, because that's going to lift her brow. She really likes the brow. The brow. I got to do it. I already know. So, let's see, I'm coming a little bit further back to really grab onto it, to understand the anatomy. The fascia that's over here, that's connected to the temple, because look what happens. Everything pulls back, you see? And then again, all of this, making it so we don't get, she doesn't feel like, you know, losing her jaw. We need to keep that structure. See? And look what it does. Look at that. Creates that line. All right, switch. One more. Almost done with the filler. So this is a great representation of Celeste. So we will turn a little bit this way. Perfect, look at that. It's amazing. So, and the jaw looks great here. We'll just do a little bit more at the edge. Good, you don't want to overdo that. And we went pretty far back here. We'll go a little bit more just to get a teeny bit of height up on the fascia. It's gonna look a little higher today because it's a little, you always bruise, everyone bruises over here a little bit. Perfect. And one more and then. Perfect. Last one. Again, close to that brow. Great. All right. So now her lip. All right, my favorite part. Right here, just a sec. We're gonna lean her back a little bit and finish it up. Do a little lip. You got some? Yeah, go ahead. All right, I'm leaning back. So she already has really nice lips, you guys. It's more about the lining. You know, even this, look at the brows. All right, go ahead, let go. All right, so look, she has nice volume. It's more about the shaping. It's giving her just that elevation. Girls just need that Cupid's bow. See, look.
Oh,
Hmm?
wow.
See the difference? You see what I mean?
Yeah.
So she has more what I call pouty Cupid's bow. It's where it goes into the middle, but they kind of connect. So you have to be careful because people want to make a sausage lip when they do that. So you really lift that upper middle and like really bring it up. See? Okay, now let's see. Oh, let me see. Ooh, wow. Oh my God, those are beautiful. See? Since I didn't impress myself. Done this a long time.
Can you put someone in here so they can change that out, the light, because it died.
Jordan, Toronto, Jordan.
Okay. You guys see? Good. Now over to the other side. So it's a little straighter, higher. That's good. It's so crazy to see how much it refreshes people. You ask Nadine if she's ready for a consult.
Nadine, are you ready with the consult? She just sent the email for the urge.
Okay, tell her I'll be done in 5. I'll be ready.
Okay, Dr. Emer will be ready in 5.
Let me see. Oh wow. Okay. So what we're gonna do is just define the Cupid's bow a little bit more, a little more superficial.
Oh wow, this looks so good.
Mm-hmm.
So this is an older technique. We might go along the line, but it looks really good on her. So we're gonna outline it just a little, because this is gonna really make her face pop.
What type of face shape does that technique usually?
That's a good question. I don't know the answer. It depends on the person. I feel like because she's more, her facial structure or features are bigger. I think having little outline, it makes it pop in certain people. So for her, because she's more structured, I think it works good for her. Okay. All right, we're ready. This area always gets a little swollen, but other than that, it should be great. Look at those lips. What do you guys think? Got the girlies. I got the girls here. All right, so here's the Emer reveal. You're going to flip the phone. You're going to give her the phone, and you're going to hold it 45 degrees. You lift your chin. No, you don't go up. Don't go up. Lift like this. Hold the phone, but lift it up. Bring the light. Bring the light. Come down here. I'm going to show you. What do you think?
Looks good. I like it.
Okay, so higher, it's obviously swollen, or a little more angled, a little more outline, and a little more lifted, and a little bit more structured. Now I'm gonna raise you up so you can see it a little bit more. What do you like in look? What's the normal hair? Let's go a little bit.
I like that my lips are asymmetrical now.
Go like this. Hold it there for a second.
The
Bring it-
cheeks are lifted.
What did you
I-
want?
To feel rejuvenated and look like I slept.
You look like you slept and you look like you're a model.
Yeah.
Turn a little that way. Now obviously the swelling goes down, but I want you to bring it in a little bit so as you can see. So obviously there's swelling, but look you guys, with filler here, it brings this back. So when we do our threads and we go like this, it's gonna be all lifted up and she's gonna feel a lot tighter. When this swelling goes down and this comes up, she have more of that contour and it will lift. And then when you look straight, you have more softening and more angle, more lifting, especially here. All right, bring in the regular mirror. Not that one because it's real close. Oh, make that one. Let go of that. Take this, and then see.
Oh yeah.
It's harder to see on there, but obviously swollen now. But what do you think of the lip?
I love it. I didn't think that.
I didn't even think you had a lip shape
no,
like that at all.
Me neither.
I love it. It makes your teeth look longer and open, big smile. You know. All right. Well, let's take some pictures. Let the swelling go down, and then I'll be back to do the lift. It's really, really amazing. Actually.
Yeah.